Harpster.
Hi.
My name is Stacy. I'm going to be your nurse for today.
All right.
I'm going to wash my hands before we get started, okay?
Please do.
All right, can you please tell me your name and date of birth?
It's Douglas Harpster, 6/27/83.
All right, everything matches. I'm going to go ahead and get started at the beginning of my shift and get a set of vital signs and do an assessment, okay?
Sounds great.
All right, let me get you hooked up to the blood pressure machine. All right, and you can relax your arm. While the blood pressure is taking, I'm going to be paying attention to Mr. Harpster's respiratory rate. He is breathing at 18 beats per minute, which is completely normal. I've observed that his respiratory rate is even and unlabored. All right, Mr. Harpster, your blood pressure is done. The recording was 166/92. That is considered high blood pressure. Now I'm assessing your pulse rate. That's how fast your heart is beating per minute. Your heart is beating at 80 beats per minute. That's a normal finding. Next, I'm going to check the oxygen level in your body. Great. Your oxygen level is 99, and that's on room air. Mr. Harpster doesn't have any oxygen. Last, I'm going to take your temperature. Boop. 98.6. That's great. That's the total normal temperature. Can you tell me if you're in any pain?
Not at the moment.
Good. All right, so I've already assessed that Mr. Harpster is awake and alert. Can you tell me where you are, Mr. Harpster?
St. Mary's, room 204,
And what year is it?
2017.
And do you know what today's date is?
Sunday, November 11th.
All right, great. So Mr. Harpster is alert and oriented ×3. Next, I'd like to go ahead and get started on a full head-to-toe assessment. That means that I'm going to start at your head and work my way down, assessing multiple body systems. You ready?
Sure.
All right.
Let's get it started.
So, I'm going to go ahead and put some gloves on. Great. We're going to start with your eyes. I have an eye chart here that I'd like for you to read. Can you please cover your left eye and read to me the smallest letters that you can read without squinting?
LEFODPCT.
All right. Now can you cover your opposite eye and do the same thing?
LEFODPCT.
Great. You have 20/20 vision. All right. Now I'm going to assess your eyes. I just want you to look straight ahead, and I'm going to shine a light. And from the opposite side. Great. Your pupils are equal, round, and reactive to light and are 3 millimeters in size. All of that are normal assessment findings. Now, I'd like to assess your hearing. Can you please close your eyes for me? And please tell me what side the sound is coming from.
My right side. Left side.
All right. Great. Now, can you smile for me? All right. Good. I'm assessing to make sure that each side is symmetrical and even. And that was the case. Now, can you stick your tongue out for me? And open your mouth a little. and move your tongue side to side. Great. Now, can you move your head side to side? All right. Now, I'd like you to shrug your shoulders for me. Can you do both sides at the same time? All right. So I'm assessing for symmetry and everything looks good. Good. I'm now going to check your neck. First I'm going to feel and then I'm going to listen.
Don't forget about my feet. Pushing.
All right. And can you hold your breath, please? Good. I'm also going to be visually inspecting and looking for jugular vein distension, which I do not see in Mr. Harpster's case. Mr. Harpster, can you tell me what brought you to the hospital?
Yeah, I had a really bad headache earlier.
And do you know what the doctors are saying is the cause of that bad headache?
No, I don't.
Your blood pressure on arrival was extremely elevated. It was 210/105. So your blood pressure is coming down on medication, but we need to continue to monitor you to ensure that it's at an appropriate normal level before we send you home. I'd like to assess your IV. This is where we're giving you blood pressure lowering medications. The site looks good with no redness. I'd like to make sure that it's working. I'm going to flush it. All right, looks good. Now, I'm going to assess some other pulses throughout your body. All right. You also have pulses in your femoral area. If I had a reason to check those, I would assess those. But in your case, I don't.
By all means.
Your pulses are strong and even, and that's all a good finding.
Great.
Next, I'd like to listen to your heart sounds. All right, your heart sounds good. I'm really listening for normal as well as abnormal heart sounds. I hear a good lub-dub in you and no abnormal heart sounds.
Great.
Next, I'd like to listen to your lungs. All right, I'm going to assist you to a sitting position so that I may listen to the back of your lungs. Please take a deep breath for me. All right, your lungs sound nice and clear.
Good.
I don't hear any crackles, wheezing, or stridor. So you have a normal assessment finding.
Great.
All right, I'd like to please continue looking at your skin. I'm assessing the temperature of the skin on the upper arms, as well as the legs. The skin is warm and dry. There is normal hair distribution. I do notice an abrasion to the right lower leg. Mr. Harpster, what happened?
My cat attacked me.
Oh my. Well, we will continue to watch it to make sure that it doesn't get infected. Right now, it looks okay.
Good.
I'm assessing for edema in the upper arms as well as the legs, and I did not see any. So you have no swelling. I'm going to press down on your nail bed. Your capillary refill is brisk and normal. All right. Now, I'd like for you to grab my hands and squeeze them. Great. There's normal strength in both arms. Now, push against my hands, please, with your feet. All right, good. Normal strength. Can you please raise your left leg off the bed? And now you can put it down. And same thing with the right leg. And you can put it down. Great. Now, I'd like for you to try to push against my hands. All right, good. I'd like to lay you down for the next part of the assessment where I listen to your bowel sounds. Are you tired?
Yeah, a little bit.
All right. Your bowel sounds are nice and active. When was the last time you had a bowel movement?
This morning?
And was it normal?
Yep.
Good. How about eliminating urine? Are you peeing okay?
Not a problem.
Good. I'm gonna press on your belly, okay? All right. The abdomen is symmetrical on both sides. It's soft and not distended.
What do you mean it's soft?
It's soft. All right. Would you like to sit back up?
Sure.
There you go. All right. I'd like to talk to you a little bit about risk factors and what brought you into the hospital.
Okay.
Having high blood pressure places you at an increased risk for heart disease. That's why it's so important that we get you down to a normal value.
Okay.
Now, looking at your chart, I see that you're 6'1" and 200 pounds. That puts you with a BMI of 26 and in the overweight category. Can you talk to me a little bit about your diet?
Yeah, well, breakfast I usually have fast food. I usually eat a pretty healthy lunch. And, dinner, they're not too bad, but I like to eat ice cream at night.
All right. Well, you said something that caught my attention, talking about fast food. Fast food is high in sodium as well as trans and saturated fat. And those things aren't good for you. They can increase your blood pressure as well as increase your overall weight.
Excuse me.
So, I'd like for you to try to make some dietary changes. I'd like you to keep your sodium under 2,000 milligrams per day. A lot of processed food has sodium in it that people don't really think about. So it will be important that you read labels.
Okay.
All right.
Don't work on that.
Let's talk about some other risk factors. Do you smoke?
No, ma'am.
Great. I encourage you to keep up that good behavior. How about physical activity? Do you exercise on a regular basis?
No exercise. I do hunt, so that takes a lot of work.
While that's true, Mr. Harpster, it is also important to make sure that you're getting 30 minutes of physical activity several times per week. This can be something as easy as going for a walk, but we also encourage you to increase that and do moderate physical activity. So biking or jogging. Just some things to keep in mind to reduce your risk of future heart disease episodes. How about family history? Does anyone in your family have a history of heart disease?
Yeah, they do.
Yeah, well, that's all the more reason to try to make changes while you're still young to reduce your overall risk.
Okay.
All right. Some things you can't control, like your age. So the older you get, the higher you are at risk for medical complications and chronic diseases. So it's important that you try to do what you can when you're young to set yourself up for a lifetime of healthy living. Now, I'd like to review some lab results with you.
Okay.
Your hemoglobin A1C is slightly elevated. Hemoglobin A1C tells us about how well your blood sugar has been controlled for the past 3 months. Having high blood sugar increases your risk of diabetes, and that can lead to a host of other complications.
Okay.
Okay? So I'd like you to try to modify your diet in addition to watching sodium intake and fats. You should also watch your sugar intake.
Okay.
All right? Also, I'm looking at your cholesterol level, and your cholesterol is elevated. It's over 200, and we really like that number to be less than 200. So with the dietary changes that we talked about, you should be able to lower that number. Your cholesterol is broken up into 2 different values. HDL, which is the good cholesterol, and LDL, which is the bad cholesterol. Your healthy cholesterol is low, and your bad cholesterol is high.
Well, great.
But the good news is, if you make those dietary changes that we talked about and increase your physical activity, you can reduce your cholesterol and reduce your risk of heart disease in the future. Do you think you're motivated to make some of those changes?
I think so.
Great. Now, meals should be passed out shortly, and then it'll be time for medications. So I'll be back soon to give you those. Is there anything that I can get for you right now?
Oh, no, I think I'm good.
Great. All right. Well, I want to make sure that you have your call bell in reach. If you need me, you just hit this red button right here.
This red button?
Yep, that's the one.
Okay, perfect.
All right. See you in a little bit.
Thanks, Stacy.